What needs to be done on my face in order to take a few years off and look fresh, especially lower face? I'm a 46-year-old woman, never had any facelift or other things done on my face, aside from a 30% TCA peel 2 years ago. My face is getting saggy lately, and the things that bother me the most are my lower face, the sides of both cheeks, and together with it goes these two lines on the sides of my lips and the double chin. I am interested in something not too drastic like a major lift with big scars. I hope there's another option with minimum scars or operated look. Thanks a lot.
Thank you for your question. You submitted a photo and you're basically asking what you can do to take a few years off. And in the substance of your question, you state you're 46 years old, you've not had any other procedures other than a TCA peel, and in particular, you're concerned about the appearance of some lines under the cheeks as well as around the mouth. Well, certainly I can assist you with this. These are questions that we deal with every day in our practice. I'm a board-certified cosmetic surgeon, certified by the American Board of Cosmetic Surgery, and fellowship-trained oculofacial plastic surgeon through the American Society of Ophthalmic, Plastic, and Reconstructive Surgery, practicing in Manhattan and Long Island for over 20 years. And the addressing of facial aging through cosmetic eyelid procedures and facial rejuvenation procedures, from short scar facelifts to extensive face and neck lifts to now additionally non-surgical facelifts, is something we do every week and deal a lot with in our practice. So with the photo you submitted, it's clear that your analysis is really very accurate. But to give you an idea of how to make this decision about whether to lift or to add volume is to understand the facial aging process. Facial aging is two things. One is its volume loss. Volume loss through loss of bone, muscle, fat, soft tissue. The face, especially in particular areas where there's bone loss, you notice these lines starting to form, particularly in the lower face where the vertical lines next to the lips called the marionette lines. In addition, it's also sagging, where you lose the elasticity of both the skin and the support structure of the skin called the SMAS, or superficial musculoaponeurotic system, in addition to the other volume loss. So one of the things that I would suggest considering in a situation like yours, which has been very successful for us, and again, this is in the absence of a physical exam. When I evaluate a patient, and they will very often hold up a mirror and they will pull their face up and say, "Doc, can you just make me look like this?" We often refer to it as a mirror lift. It's essentially identifying that they don't like certain lines and they feel like getting rid of those lines or softening those lines makes things better. Well, the decision to lift or to fill at a certain point in time is based on how much sag there is. And judging by the photo, it doesn't look like you have that much sag, which means that there's a role for some type of volume correction. Now, traditionally in the cosmetic field, it has been always the focus to help people by treating the lines. So whether it's the nasolabial fold or the mesolabial fold, it's to treat the lines. And in addition, there's also some soft tissue augmentation, where let's say that someone's cheeks are getting flatter, adding volume in the cheeks. But part of the problem with traditional methods of filling is that you are treating lines that are reflective of the loss of volume in the structure, and it's very hard to really get a great correction of those lines. When it comes to the filling of soft tissue, you are limited by the elasticity and the ability to hold the material that you fill into the skin. When skin is getting thinner and sagging, it can become lumpy, it can become irregular. So a lot of times people who have a lot of filler with the intention of having smoother skin and looking younger, they end up looking pillowy and doughy. Well, in our practice, we perform a procedure called the Y lift. And the Y lift is based on the idea of structural volumizing, where we're putting the fillers that you're familiar with, such as Juvederm Ultra Plus, at a deeper level on the bone structure to expand and restore some of that structure that you are missing. It's very interesting phenomena when we look ourselves in the mirrors, and when people look at themselves, they focus on lines. And we have examples of patients who came with that concern, and then when we restore structure to the other areas, actually the last thing we did was we didn't actually fill those lines, but we restored structure. So in the Y lift, what we're doing is we're structuring cheekbone structure, vertical aspect of the jaw and the jaw line, as well as the chin. And so what we're doing is by restoring structure, it's almost creating a lift, but a lift through expansion and restoration of structure rather than through the vertical lifting of skin. There's even a combination approach where we can do a limited lift of the skin and the underlying structure called the SMAS, and do filler at the same time using this Y lift method. It sounds sometimes it seems too good to be true, and the results often look too good to be true, because it's really a very special technique that a handful of us are trained to do and do. And unfortunately, a lot of doctors who don't do this don't understand it, and naturally, in the competitive, unprofessional environment we live in, will disparage it. So understanding that, you may want to at least find a doctor who performs the Y lift and learn more about this, because my impression is that a little bit of structural volume will go a long way for you, and you don't necessarily have to go for a surgical facelift unless there's a lot of sagging, which of course I can't really tell without an examination. So I hope that was helpful. I wish you the best of luck. Thank you for your question.